This is Talk with Audrey. As the coronavirus claims more American lives and the rate of infection rises, the question of health and equity is rapidly becoming a major issue in underserved communities. Joining me now, Angela Clabon, the CEO of Care STL Health in St. Louis and equity advocate. And we're going to talk about, are you ready for this? The lack of COVID-19 testing in St. Louis for African Americans. Welcome.
Welcome.
You're very welcome. Thanks so much for joining me. So I understand, Angela, you have been in healthcare for 37 years. Have you ever seen anything at all like this?
The only thing that has come close to this is when the AIDS epidemic was first introduced, but it still didn't reach to this level.
And even though it didn't reach to this particular level, did you find sort of some of the same components that are driving the levels of infection in the African American community?
No. If we look back to the AIDS epidemic, it stigmatized gays and lesbians. This pandemic, especially when it results in death and is so unknown, I found myself fighting for a community that was left behind. I have done a lot of work with, in regards to racial equity. I am the only African-American female of an FQHC in the state of Missouri. So speaking up for African-Americans has become my call to life. And so I'm accustomed to doing it. I have worked so very hard, and I really thought I made progress in our state and city in regards to racial equity, and then the COVID-19 virus or pandemic hit, and the testing was offered to affluent communities, and North St. Louis was left behind. So I had to fight for testing kits. I initially received 5 kits. I had 1 exposure, and those 5 kits were utilized in 1 day. I do have testing kits. Now we have opened up a drive-through testing site for our community. I went out on faith. We did not have the kits when I started the drive-through, but I have received donations from hospital systems and private vendors in Florida. So persons have been stepping up trying to help us. Most persons know when we talk about equity, in the city of St. Louis, we had 14 individuals who died from COVID, and all individuals were African Americans. So this is a huge issue for me, and I'm still serving on faith. My staff, they are diligently showing up, and even though they're working in fear, we're still showing up every day, trying to do the best that we can with this. But we need testing kits. We need PPE supplies. We cannot process and serve this community without masks, gloves, and gowns. And we have enough for 1 week. We have enough kits to process about 2 more days. We test 87 per day. So we made it through, but it is such a need. I was not expecting the community to ask and call and line up. They are responding, and so I can't put them on the schedule because I don't have enough kits to make enough appointments for the community.
Once you find that someone has tested positive, are they able then to access medical treatment, health care? Basically. And then what are the challenges if they are diagnosed positive with COVID-19 and they are instructed to go home and they have other family members? How are they handling this?
Well, we have several issues for the persons that we have tested and have tested positive. First and foremost, we're testing too late. Because of the shortage of supplies and the criteria from CDC, we're testing persons once they display symptoms and they're sick. And for African Americans, once that happens and they end up, we have to refer them to the hospital. And some of them are told to go home, but most oftentimes when they're coming through with those symptoms, they end up in the hospital and on the ventilator. So we're already behind the 8 ball. We need to test before they are short of breath and they're struggling. But we short of test kits, so that's a struggle for us. For other individuals who have had some form of exposure, for individuals who just can't get the testing kits, we ask them to quarantine for 14 days. We did have our very first positive from an employee of our center, and we had to close the site down. We had 42 employees that we had to have quarantined. We did test all 42, which took us a while, and they were all negative, but they are quarantined at this time. So I have reached out to the community for volunteers to continue the great work. And I just want to say thank you for those volunteers who have stepped up for our community. But if you are not short of breath, you're just asked to stay home and quarantine, and you have to isolate from your family. So I hire from persons within the community. They're already struggling with babysitters and help because schools have closed. So this is a very challenging time for our communities. And if for African Americans, most of the persons that help are mothers, grandmothers, and we can expose our elderly community to persons who may be infected as well. So this is just so challenging all the way around. I've never seen anything like this in my life.
So do you feel that you've hit peak, or do you think that there's going to be an additional surge? Are cases spreading in St. Louis?
Yes, we haven't hit peak. We have most of the persons that we have tested and that are positive. They have found that several other persons in their family are positive. I've had a board member who have lost 3 of his siblings, 2 to COVID, 1 to just chronic disease in the last week. We're nowhere near peak. We're just getting started. First of all, we haven't had the luxury to test majority of the persons in the community.
Right. What do you think that we as a community can do so that we don't find ourselves in this situation, that we find that we are given the same consideration as other people, if you will?
To continue to speak up. It is not acceptable to leave out a community, and definitely the most vulnerable community. There's so much messaging that's going around currently right now in regards to opening up communities. I do understand that persons are really exhausted with isolation and social distancing, but they should not be that exhausted when it results in losing your family members and or persons within the community. When one person can infect 4 persons, and you just multiply that, these African Americans are at risk of dying from this pandemic. My ask for the community is to please continue to stay isolated. When we hear messaging that we have enough test kits, that we have enough PPE supplies, that is not true. And without those things, we will not be able to slow down the spread of this virus. We are at the forefront in the state of St. Louis, and it's so very important. And for African Americans, yes, you can get the virus. For millennials, yes, you can get the virus. Yes, you can spread the virus. And African Americans, yes, you are at risk. This is not a scam from the government saying that you are more vulnerable. You are more vulnerable because you have so many chronic diseases. And so they need to believe this and not think that it's a hoax. That's some of the things that I'm facing with our community.
Well, I don't know how anybody could possibly, quite honestly, think that it's a hoax when you see people dying, when you see disease spreading. This pandemic is real. And guys, you know, you've heard it from somebody on the front lines who is trying to help. But you know what? It also starts with helping ourselves. And if we are challenged in terms of sheltering in place or we're quarantined at home, I know it's hard. You might live in a small apartment with, many people, right? And if you live, for instance, say you share a studio apartment because it's a city, but it's also, you guys have a lot more suburban area, but you have to find a way. I don't know exactly what that way is, but you have to find a way to quarantine yourself away from the rest of your family so that you don't possibly infect them as well. And then they, in turn, contract COVID-19. Angela, I cannot thank you enough for sharing the bottom line here. And that is that there aren't enough tests. You mentioned you only had enough tests for 20 more days? Is that correct?
No, for at least 2 to 3 days.
Oh, 2 to 3 days. Okay. Oh, I am so sorry. She has enough tests left for 2 to 3 days. And that was 80 some odd people per day. Is that correct that you're able to test?
Yes, that's correct.
Okay. Thank you for that correction. Clearly, you don't have enough. Mayor and the governor, are they sending you more supplies, more tests?
Yes, they are. They're struggling with the same dynamic. Something is happening from the federal level. They have been ordering, and I've been ordering, and our supplies have been redirected. This is really real. This is not a myth. I started ordering supplies and tests in early March, and our supplies are on back order. The mayor and the CEO of the health department, we have been in prayer session trying to get our test kits, and we'll get a notice that the supplies have been redirected. I cannot tell you what is going on in the United States of America with the shortage of kits and what's prioritized, which is why I'm speaking up, because African Americans and populations of color are so vulnerable, and we need to be fair in the distribution of test kits. And the Americans need to know we do not have enough. We just don't. Regardless of what's being said, there's a major shortage. We do not have enough test kits.
I always say informed's empowered. And guys, now you're informed, and it's up to you to be empowered and to empower those around you. My guest has been Angela Clabon, the CEO of CARES STL Health in St. Louis. I'm praying for you and your community, and collectively, we have to pray for one another and do the right thing in terms of quarantining if you have to and sheltering at home. This is a very dangerous time. We don't have to die in these huge numbers if we do what is necessary in order to protect ourselves and our families. Angela Clabon, thanks so much for joining me.
Thank you for having me. And everyone, please stay safe.
You too.